Hey everyone, it's Mrs. I. We're going to review the cardiovascular rubric today. So the first things first is we would inspect the precordium. So what we're looking for is we're looking for any color changes of the chest. So the precordium is the chest wall, that interior chest wall. So we're looking for any color changes different than their normal coloring of their skin, and we'd also be looking for any lesions or abnormalities of their skin. After inspection, we'd go into palpation. So palpation's using our hands. So we would palpate the left sternal border. So we'd find our sternum, which is that middle bone. So if I'm looking at my friend Sam here, this is the sternum. It's that hard bone in the middle of the chest running through the midline. So it'd be my left sternal border is going to be along the patient's left side of the sternum. And then I'm going to be palpating the base of the heart, which is actually the top of the heart, typically in third intercostal space. And then I'm going to be palpating the apex of the heart, which is the fifth intercostal space, and then that's the mid-clavicular line. So if I'm drawing a line from the middle of the clavicle, usually runs down through the nipple on the chest, and we're gonna palpate for the apex. You could actually feel the heart beating against your fingertips when you're palpating at the apex of the heart. And the apex of the heart is the same place as the point of maximal impulse, or the PMI. So we're gonna stay here and we're gonna palpate the PMI at the same spot. And then we're gonna identify the rest of the locations that we're gonna be auscultating. So we're gonna identify the aortic, which is in the second intercostal space, right sternal border. So on the patient's right, we have aortic. Moving across the sternum, we're gonna go to the pulmonic. So aortic, pulmonic is second intercostal space, left sternal border. Then we have the Erb's point, which you just move down one intercostal space. It's going to be third intercostal space, left sternal border for Erb's point. Then you're moving down to tricuspid, which the tricuspid is fourth intercostal space, left sternal border. And then we're coming down to the mitral, which is the same location as the PMI and the apex, which is fifth intercostal space, and it's mid-clavicular line on the left side. After that, we're going to auscultate there at that spot the apical heart rate. So you're going to put your stethoscope on, will already have been cleaned, and we are going to listen to the apical pulse here. You listen for 1 full minute. Okay, and then you auscultate for your S1, S2 sounds at the same spot. So aortic, pulmonic, Erb's point, tricuspid, and then down here at your apical, at the mitral valve. And that you would identify any abnormalities in your findings there. The next part is we're gonna go through the central vessels. So we're gonna go back to inspection, and we're looking at the neck. So when we talk about central vessels, we're talking about your jugular vein, and we're talking about your carotid vein, or your carotid artery. So the first thing you're gonna do is you are going to inspect your jugular vein using a pen light. So we should not see the jugular vein on a normal, healthy person. The jugular vein would only be distended when we have some excess fluid volume in our body, and we're seeing the jugular vein would pop up in several different scenarios. But what you're looking for is you're gonna shine your light on the sides of the neck, and you're just looking to see if you have any jugular vein distension, or otherwise abbreviated as JVD. You'd have them turn their head, shine the light, and then you're not gonna, on this patient, we're not gonna see anything. The neck will be flat, just like that, okay? So we've inspected the jugular veins. Next, we're gonna inspect the carotid arteries. So the carotid arteries, if you also have them turn their neck and you shine more towards the anterior aspect of the neck, you'd be looking for a pulsation, which is expected. You should be able to see the carotid arteries pulsate with the light, just kind of a flickering of the skin. Next, once we've inspected the carotid arteries, now we're gonna palpate the carotid arteries. And you only ever palpate one side at a time. So if you're feeling for your own carotid arteries, you're gonna find the middle of your neck, which is where your trachea is. And then you're gonna go down into the ridge next to it. And then you're gonna hold it there and you're gonna feel the palpation of your carotid artery. The same thing with your patient. You're gonna drop down, you feel one side at a time. Once you've let go of that other side, then you can feel the other carotid artery, and you can grade them on a 1 through 4 scale. And that is included in your rubric for your review. And then once you have palpated them, then you can auscultate your carotid arteries. So you can, you're gonna use the bell, the smaller side of your stethoscope, to auscultate carotid arteries. Here and here. And you're gonna be auscultating for bruits. You shouldn't hear a bruit, that's an abnormal finding. And that's all for your cardiovascular rubric.